Hello cruel world, my name is Dr Sohom. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living, so you don't have to. You can call me the ominous Sohomalist. Now today we're diving into the chilling case of Harold Shipman. Shipman, dubbed Dr Death, is believed to have murdered over 250 patients during his career. Now let that sink in for a moment. A man trusted to heal instead became one of Britain's most prolific serial killers. Was Shipman a psychopath, or was he a sociopath, or was he something entirely different? What specific traits did he exaggerate to hide in plain sight? To truly understand the monster, we must first examine the man. So what seemingly ordinary experiences in Shipman's youth set him on this path to becoming a killer? The answer might be more chilling than you expect. Harold Frederick Shipman was born on January 14, 1946 in Nottingham, England. He grew up in a working class family with his parents and siblings. His mother, Vera, was diagnosed with lung cancer when he was just 17 years old, and he watched her suffer through the painful stages of this disease, witnessing firsthand the effects of morphine, which was used to manage her pain. So this experience, which would be difficult for anybody, seemed to have left a lasting impact on the young Harold. So Shipman's relationship with his mother was described as unusually close. Some might even say it was unhealthily so. So this intense attachment, combined with the trauma of her illness and death, could have created a perfect storm in Shipman's psyche. After his mother's death, Shipman pursued a career in medicine. A son inspired by his mother's illness to help others. But was it really that simple, or was there something darker at play? Shipman excelled in his studies, graduating from Leeds School of Medicine in 1970. He began his career as a general practitioner, quickly gaining a reputation as a dedicated and hardworking doctor. But even in these early days, there were red flags that in hindsight might seem glaringly obvious. Colleagues noted Shipman's arrogance and his tendency to belittle others. He showed a particular disdain for elderly patients, often referring to them as coffin dodgers. So this contempt for the very people that Shipman was meant to care for is a chilling foreshadowing of his future crimes. But perhaps the most significant early warning sign came in 1975, just a few years into his career. So Shipman was caught forging prescriptions for pethidine, which is a painkiller to which he had become addicted. And he was fined, and he was briefly entered into a drug rehabilitation program. So now obviously in retrospect, this incident should have raised serious concerns about his fitness to practice medicine. Instead, it was largely overlooked, allowing Shipman to continue his career relatively unscathed. Back then, doctors could help themselves from the medicine cabinet, or they could just write themselves a paper prescription. And nobody really checked on the stock. So before Shipman, doctors were generally trusted. So the experience of watching his mother die, coupled with his exposure to powerful painkillers, may have warped Shipman's understanding of life, of death, and of the role of a doctor. His addiction to pethidine is particularly telling, as it suggests a desire for control, a need to numb emotional pain, and a willingness to break the rules for his own benefit. And these traits would later manifest itself in his murders, where he played God, deciding who would live and who would die. Shipman's arrogance and contempt for others point to a dangerous cocktail of narcissism as well as a lack of empathy. Something that really stands out to me is this: he seemed to gravitate towards the elderly, which is an odd choice to me because back then you could pretty much walk into any subspecialty of medicine. It was far less competitive than nowadays. Yet Shipman chose to work with the elderly despite seeming to despise them. He wanted to be around the very thing that he hated. So maybe he was comparing all of his patients to his own mother, perhaps subconsciously. But here's the million-dollar question: how did he manage to kill hundreds of patients over decades without raising suspicion? And the answer lies in a chilling combination of medical knowledge, psychological manipulation, and societal trust.
If you were to ask any patient of Harold Shipman, who I've known for some 20 years as my GP, they would only see him like I see him, as an extremely hard-working and caring GP.
As a doctor, he had unrestricted access to vulnerable patients, particularly the elderly. He could easily visit them in their homes, he could administer drugs and falsify death certificates without raising eyebrows. It's a sobering reminder of how much power we entrust to medical professionals. Shipman cultivated an image of being the caring, dedicated family doctor, the type of person who would make house calls and genuinely listen to concerns. This facade of compassion was his most potent weapon. This is typical of individuals with psychopathy who can mimic normal emotions without actually feeling them. Shipman's method was frighteningly simple. He'd just target elderly patients who are living alone, visit them under the guise of a routine checkup. And once he was there, he'd administer a lethal dose of diamorphine, which is basically medical grade heroin. And the patients would peacefully slip away, and Shipman would conveniently be on hand to pronounce them dead from natural causes. The use of diamorphine is particularly telling. As a powerful opiate, it echoes back to his mother's cancer treatment. It's as if Shipman was recreating and controlling the scenario of his mother's death over and over again. And this repetition compulsion is a well-known psychological phenomenon often seen in individuals trying to process unresolved trauma. But perhaps the most chilling aspect of Shipman's crimes was how he exploited societal trust in doctors. Shipman weaponized this trust, using it as a shield against suspicion. So who would rightfully question a respected doctor's word on the cause of death? And Shipman's exploitation of this trust is likely to have fed into some potential narcissistic tendencies. It's almost like each successful murder would have reinforced his sense of superiority, his belief that he was better than everyone else. It's a vicious cycle that we often see in serial killers. The more they get away with, the more invincible they feel, and therefore the more murders they commit. Contrary to popular belief, I genuinely don't believe that Shipman is a psychopath. Now, clearly he has some of the traits. He lacks remorse or guilt. He has a failure to accept responsibility for his own actions. He acted impulsively. There's a huge amount of irresponsibility, and people say he was quite arrogant. But I also think Shipman doesn't have some of the other traits that is typical for psychopathy, like the need for stimulation, a proneness to boredom, and he didn't have a particularly parasitic lifestyle. He wasn't sexually promiscuous, there was no lack of realistic long-term goals, he wasn't criminally versatile. People might say that Shipman was cunning and manipulative, but was he really? Because he didn't force his way into people's houses, he didn't bend other people to his will like somebody like Manson does. I think he hid behind the protection of his profession. So is that really being cunning or manipulative? I don't think so. And then there's glibness and superficial charm that psychopaths had. Was he actually charming? Again, he was respected because of his profession, but he was also seen as quite shy and quite meek. I don't think he was actively charming.
I used to stand and let you take a photograph and then go away. And I'm sure you've had enough time to take a decent photograph.
Is it possible for you just to say anything at all?
Back into surgery to do my surgery.
But you have said you have nothing to hide.
So what is my professional take on Shipman? Whilst he displays some traits associated with both psychopathy and sociopathy, I argue that he isn't, in fact, any of those things. Instead, Shipman's case illustrates a complex interplay of some antisocial personality traits, some narcissism, and possibly unresolved trauma.
He did nothing. No one else will say any different, I can tell you that now.
Talk's cheap, isn't it, in a village like this? I mean, all sorts of rumours go around. And as I say, I feel my heart goes out to Dr. Shipman.
Regardless of the exact label, what's clear is that Shipman represented a perfect storm of dangerous personality traits, medical knowledge, and societal trust. This combination allowed him to become one of the most prolific serial killers in history. So thank you for watching. If you liked this video or found it interesting, then please give it a thumbs up. And if there's any other cases you'd like me to forensically assess, then pop them in the comments section below. Bye for now.